Now let me discuss about what is called as the two-dose strategy. Right, what is called as the two-dose strategy. Now, if you take this particular two-dose strategy, the drugs having high volume of distribution are given by this particular strategy. Now, what do you mean by this two-dose strategy is, these particular drugs can be administered as in the form of loading dose, or this particular drugs can be administered in the form of the maintenance dose. Alright, so the drugs whichever are having high volume of distribution, right, the drugs having high volume of distribution, they are given by two-dose strategy. Right, they are given by the two-dose strategy. Now, what is this two-dose strategy? One, you have the loading dose, right? One, you have the loading dose, and the other one is the maintenance dose. Right, the other one is the maintenance dose. Now, you take the loading dose. Remember, what we try to do is, first a large dose of the drug is administered. Now, what is the advantage of this? First, a large dose is administered to attain the steady state quickly, and later on, to maintain the plasma concentration, the smaller dose is given. Right, I'll tell you an example for this. Right, so right, first a large dose, that is called as, right, that is called as the loading dose is administered. Right, that is loading dose is administered. First, a large dose is administered. Now, what is the advantage of this? Once the loading dose is given or administered, this will attain, right, this will attain a steady state, right, this will attain the steady state quickly. Right, later on, alright, later on what we need to do is, later on, to maintain the plasma concentration, right, later on, to maintain the plasma concentration, what we do is, the smaller dose is given. Right, to maintain the plasma concentration, the smaller dose is given, and this particular smaller dose is called as maintenance dose. Alright, the smaller dose is called as the maintenance dose. Now, you see here, let me tell you an example. Now, you take in a patient with the coronary artery disease, right? You take in a patient with the coronary artery disease. Now, once the coronary artery disease is diagnosed in the patient, like for example, you take MI, myocardial infarction, that is ST elevation MI you take, that is nothing but your coronary artery disease. What we do in that, we give a loading dose of aspirin. So how much of aspirin we give? We give nearly around 325 milligrams. And later on, what we do is, so this 325 milligrams, this will be the loading dose of the aspirin. And followed by that, we give aspirin 75 milligrams as the maintenance dose, right? We give either 75 milligrams or we give 150 milligrams as the maintenance dose, right? Now what is the advantage here? Once you give the loading dose, that will attain the steady state quickly, right? We want an immediate antiplatelet action in a patient with the MI. So in order to have an immediate antiplatelet action in the MI, we give the loading dose of aspirin, that is nearly around 325 milligrams, and followed by that what we try to do is we try to give the smaller dose. Now once you give the smaller dose, that will maintain the steady state concentration, right? Because the steady state concentration you have attained quickly by giving the loading dose. Now in order to maintain that steady state concentration, we give this maintenance dose, that will be either 75 or 150 milligrams of the aspirin in patients with MI. Now you take about this loading dose. Right, you take about the loading dose. Remember, it is mainly used for the drugs having long T-half and large volume of distribution, right? This is a very, very important point. So regarding the loading dose, what is a very important point? Remember this, it is mainly used for drugs having, right, it is mainly used for the drugs having long half-life, right, and as well as large volume of distribution. So if you see this loading dose, it is mainly used for the drugs having long T-half and large volume of distribution. Remember, what is the advantage of giving the loading dose is, it is given to load the tissue stores, right, to saturate the tissue. So it is mainly dependent on the volume of distribution, right? So loading dose, it is given to load or saturate the tissues, right? It is given to load or saturate the tissue stores, right? Saturate the tissue stores. So it is mainly dependent on the volume of distribution, right? The loading dose, it is mainly dependent on the volume of distribution. Okay, so loading dose is given by the formula, right? Loading dose is given by the formula volume of distribution into target plasma concentration. Right, loading dose is equal to volume of distribution into target plasma concentration, that is called as loading dose. You take the maintenance dose. Right, you take the maintenance dose. Maintenance dose, remember, it is mainly dependent on the clearance, right? It mainly depends on the clearance of the drug. So alright, it is mainly dependent on the clearance. Now you take the maintenance dose. Maintenance dose is equal to, right, maintenance dose is equal to clearance into target plasma concentration. Right, maintenance dose is equal to clearance into the target plasma concentration. That is what is called as your two-dose strategy. So remember, drugs having high volume of distribution, we follow this particular two-dose strategy. right? That is nothing but your loading dose and as well as the maintenance dose. First, a large dose is administered, that is loading dose is administered. And what is the purpose of it? Mainly to attain the steady state concentration quickly. Later on, to maintain the plasma concentration, the smaller dose is given, and that is nothing but your maintenance dose. For example, you take in a patient with the coronary artery disease, that is MI, loading dose of aspirin is given, that is nearly around 325 milligrams. And followed by that, we give maintenance dose of aspirin, that is around 75 to 150 milligrams as a part of the maintenance dose. And loading dose, remember, it is mainly used for the drugs having long T-half and large volume of distribution. And the purpose of giving the loading dose is, it is given to load the tissue stores, so it is mainly dependent on the volume of distribution. So loading dose is equal to the volume of distribution into the target plasma concentration. And you take the maintenance dose, it is mainly dependent on the clearance. So maintenance dose is equal to clearance into the target plasma concentration. Next let me discuss about what is called as therapeutic drug monitoring.